I had a chiropractor mentor tell me, you like this, Dr. Nick, that a person coming in to see me as a chiropractor, they're not just a spine walking into your office. They have a heart, they have a mind, they have a spirit, they have a whole person to them. And to listen, caring enough to listen to the person. I find just inviting people to have a conversation with me, taking the time, the necessary time, it could be 20 minutes, it could be 10 minutes, it could be an hour, but having a conversation, and out of that conversation, along with me asking questions to see a little bit deeper what's going on, serendipity usually always happens in terms of discerning next steps. Those next steps have to do with assessing to know. That's a compass, not a watch, for those in the back there. So we need a direction to move it. That direction has a lot to do with looking at lab assessments. There are many, 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 many lab assessments. You had your blood tests, but there are many other type of blood tests, saliva tests, urine tests, adrenal tests, hormone tests. So where do we start? I found two central places to start. The first one is NutriSync Genetic Nutrition and Fitness Assessment. I have brochures about that here. This is a lifetime map to maximize your genetic potential for health. Epigenetics. It will tell you, fitness-wise, you look like a fitness coach, Michael, rather than a financial coach.
I am as well, yes.
It will tell you, fitness-wise, the percentage of, say, endurance versus power, according to your genetics, to maximize your potential. It will tell you need, say, 30% endurance activities and 70% power activities to maximize your specific genetic potential. It will tell you what kind of exercises your body may need. It will also give you an idea of what kind of nutrition your body will need. To me, this is the big picture. Epigenetics has to do with your lifestyle choices. We're finding the choices we make turn genes on or turn genes off. Your genes are your genes. They don't change, but the expression of your genes changes. So you want to turn the genes on, then enhance your health, and turn the genes off that lead to disease. The next test is mediator release testing food sensitivity test. Again, I've narrowed down two starting points. This test is for people to navigate, it's an immediate map, to navigate through intense health concerns or health performance optimization. Let me tell you, intense health concerns. I wish I had known about this test when my GI problems first started, because I was going to my friends and they were looking to address my concerns, but nothing was working. I feel if I had done the MRT test at that point, it could have diverted the path my body went into. In terms of health performance optimization, lots of athletes have done testing like this, because what it does, if you find the foods that work for you, it decreases the inflammation, it cuts out the foods that are causing inflammation. Foods that cause inflammation, I would say slow down your body. There's been basketball players who've done this, and it helps to optimize the performance. Now we're all here, we're business people, we're our own entrepreneurs. We need to be as productive and effective as possible. So this kind of test can raise your game. How much time is that?
Another minute.
Another minute? Okay, recommend to health. Health. Lifestyle medicine. Now the choices we make have a lot to do with turning those genes on. I'm going to go through quickly. I coach people with these elements: thinking healthy, mastering stress, healthy eating and drinking, fitness, friendships, and sense of community. Blue zones, a common factor is our sense of community. When we have that, it improves the quality and quantity of our life. All of our health, we're not supposed to be healthy on our own, but we're supposed to be in a position to play our part with others. I might need some extra time here, you mind? Recommend to help, the R part. Natural support. Now there's lots of natural supports. There's electrical therapies. I found I have a pair of orthotics, special orthotics in my shoes that have been helpful with my hip. Nutritional supplementation. There's a product called curcumin that I've been using. It's a derivative of turmeric, and that's been helpful for the pain in my hip. Finally, I'm able to come to these meetings on a consistent basis where before I wasn't able to do that. symptom survey. Now, there's a symptom survey with lots of different symptoms, many symptoms that you look to approach nutritionally rather than jumping to a medication. Look to try that, do that first, because I'm getting the speeded up version here. Stay, bear with me here. Encourage to greater health. Coaching strategies, this is what I do business-wise. Single sessions if needed. 3-month health programs. People need to be engaged in the health process. If I have a single session with someone, usually they might hear me, but they don't maintain it. Having an ongoing program helps to establish those healthy habits. Ongoing supports, self-tracking. We all need to self-track in order to stay on track. I help coach people with that. Cultivate and establish healthy alliances and healing partnerships. This is a summarization of what I do. This is the template I use in each one of my sessions. I care to understand first. I assess to know to see what's going on. I recommend to help. I encourage a greater health, and I encourage people to develop healthy partnerships with me, with the people that they're closest with, because when you develop a partnership, it goes beyond yourself and it establishes what you need. It helps to establish within yourself to make those right choices. Play your part. Now, we all have parts to play here. Today, I'm asking you to play your part with me to expand the influences of health through people. The part you can play is simply invite someone you know with a health issue to have a conversation with me. I love having conversations with people, whether they become a patient with me or not, but out of that conversation, again, serendipity happens in terms of what next steps would be helpful.